So welcome everybody to our Australian-New Zealand Hip Fracture Registry mini lecture series. I'm Jacqui Close, I'm one of the co-chairs of the registry. And with me today is Dr Bianca Wong. And Bianca is the lead for orthogeriatrics at Lyell McEwin Hospital down in South Australia. So Bianca, welcome to our mini series today. Now, for people wondering why we're interviewing Bianca, Bianca works at a hospital where, when you look at the hip fracture registry report, we see that they consistently have relatively high rates of prescription for treatment of osteoporosis on discharge following hip fracture. They're sitting currently at about 50% of their patients go home on treatment for osteoporosis, and that compares to some hospitals where it's well below 10% and is certainly above the average that we see for the whole country, which sits around 32–33%. So Bianca, my question to you is, what is it that you do at Lyell McEwin that allows you to be able to initiate higher levels of treatment for osteoporosis following hip fracture than many other hospitals in the country? I'm curious to hear what the enablers are and maybe what some of the barriers are. So over to you.
Thanks, Jackie, for the introduction. So we run a share care model at the Lyell McEwin Hospital. So all the hip fracture patients are admitted under joint bed cards. We have a systematic hip fracture pathway where there are elements and prompts for staff who are admitting hip fracture patients to think about osteoporosis. So for instance, we have a hip fracture admission pack that prompts to think about osteoporosis prescribing even on the day when patient are admitted. And we know often one of the barrier for prescribing and dispensing patients on anti-resorptive upon discharge, it's waiting for vitamin D level because it doesn't come quick. So what we've been trying to do over the years is providing ongoing education to our staff, highlighting the importance that vitamin D level needs to be done on admission, but not prior to discharge. So then we are able to facilitate increased rate of discharging patients on anti-resorptives. Obviously, there are a proportion of patients that we cannot prescribe anti-resorptive because of chronic kidney disease, and for some patients, which we are actually actively palliating. So balancing the benefit of dispensing anti-resorptive, and therefore we will never be able to be prescribing 100% of patients on anti-resorptive, but trying to target the ones that will benefit.
Great, thank you. And I guess you're good at getting hip fracture patients on treatment for osteoporosis, but orthopedic services and orthogeriatric services admit patients beyond hip fracture. What are you doing at Lyell McEwin in terms of those patients? Are they also getting access to treatment?
So over the years, we are also trying to provide education to our orthopedic staff in thinking about osteoporosis, assessment and management for non-hip fragility fractures. So with our share care model, we only admit patients under our joint bed card that are admitted with hip fractures, but we do provide a consultative service for other fragility fractures. But one of the challenging aspects of this is we do rely on orthopedics to refer those patients to us. So there's still a gap that we'd like to fill, but for a start, we find ongoing education to rotating interns, registrar and RMO certainly have helped to improve the uptake rate and also get them to think about osteoporosis. So prior to discharge, to improve discharge of dispensing anti-resorptive for non-hip fracture patients.
Great, thank you. I guess the other important group of individuals who are not necessarily under orthogeriatrics, but the group of individuals who come to hospital with a fracture, who don't necessarily get admitted, but the low trauma fractures in people in their 60s and 70s. In New South Wales, it's compulsory to have fracture liaison services. So our local health districts are all expected to have fracture liaison services. Is that common in South Australia at this point in time, or do you have systems in place to deal with that group of individuals?
Well, looking at locally within our organisation, at Lyell McEwin Hospital within the Northern Health Network, we don't have a liaison fracture service. So those patients that you've mentioned may well slip through the gap. It would really be useful to actually have the liaison service in there so we can encompass and identify all these patients, and that's also a gap we would hope to work towards to fill. As far as other organisations within South Australia, it's at Flinders, they do have fracture liaison nurse, but it depends on individual hospital. So it's not standard care in South Australia at present.
Great, thanks, Bianca. I guess in terms of hospitals who are struggling at the moment to initiate treatment, what would your tips be to them starting out? And I guess I'll ask you as well whether the resource pack that you referred to at the beginning, would that be something you would be happy to share with other hospitals as well?
Oh, definitely. I'll be more than happy to share the admission pack. I've shared it with other hospitals within South Australia last year when we did our ANZHFR Fest and circulated the admission pack, as well as I've also created a discharge template, and within the template we have included false assessment and osteoporosis as part of it. It's just little prompts to remind people to think about osteoporosis treatment and not just thinking providing surgery, it's the only treatment for hip fracture. We need to think about falls prevention and how to prevent or reduce risk of fragility fracture. So something really simple for other hospital to do, it's really educating the junior staff and telling them to do vitamin D on admission. And that wouldn't cost too much money or a lot of resources. So.
Yeah, great. That's really good advice. We struggle with waiting for vitamin D levels to be back to see whether we can initiate treatment. So that's something I will certainly take away from today, is actually getting the vitamin D level done on the day of admission. And for those who are interested, I'll take Bianca up on her offer and we'll pop the resource pack that Bianca is referring to up on the ANZHFR website. So Bianca, thank you very much for your time today. It's much appreciated.
Thank you for having me today, Jackie.
Pleasure.
Thank you.